I am Victoria. I'm a sickle cell patient who received the gene editing therapy. I'm also a mom of 4. My oldest is Asia, my oldest son is Jamarius, and I have twins, Jaden and Jadasia. Sickle cell disease is an inherited blood disorder that causes the red blood cells to be misshapen, which causes them to get stuck in the blood vessels and cause blockages, which also causes pain and lack of oxygen. I would have pain in my arms, in my legs, my back, all over my body. The pain felt like lightning strikes, and sometimes it felt like I was being hit by a truck. And the only treatments was just more pain medicines, IV fluids, and blood transfusions in hopes that I would just overcome it after time. I really wanted to become a nurse, and I couldn't, so because I had to miss so many days out of college, I just stopped dreaming of becoming a nurse. By the time I was 30, I would be in the hospital at least once a month, and those hospital stays were very long, 2 weeks, a month at a time, and it seemed like once I would get out, I was only returning back to the hospital again. It really affected my children. Like, my daughter would call me and say, "Mom, I was crying last night." And I said, "Why were you crying?" She said, "Because they took you away in the ambulance and I was scared." I have 2 sons, and their behavior started to change at school, where they would act out and get in a lot of trouble, and the grades changed. So my oldest son's teacher, she called me in for a meeting, and she said, "Victoria, I'm going to be honest with you. Jamarius is acting out because he thinks you're going to die." And that was heartbreaking, that my kids had the fear of losing me. And what was worse, like, I felt that I was going to die too, and I didn't want to be without them, so I was willing to do anything. Gene editing has really changed my life. I no longer have hospital stays. I no longer have ER visits. I no longer get blood transfusions. And I no longer have pain. I look forward to my future. I work full-time. I get to participate in my children's activities. They get to live normal lives as teenagers with normal worries as far as what outfit are they going to wear and who are they going to take to prom. I think gene editing can not only help people with sickle cell disease, but people born with all type of genetic disorders. Getting this and seeing the turnaround gives me hope for my family and for others who are suffering, who feel like that's just the end, that they have to die with what they were born with or what they develop later in life. But now there's hope that treatments are out there and we are advancing. So don't give up, hold on, help is coming.
All right, good morning, everyone, and welcome to day 2 of Meeting on the Mediterranean. That video of Victoria Gray was just extremely inspirational, and I've had the opportunity to meet her twice, actually. She won an award last year at the Emily Whitehead Foundation Gala, and she's also going to be in participating in one of the Luke Timmerman treks in October. And so, I mean, if you think about what she just described with regard to her sickle cell symptoms, to now being a part of one of the Luke Timmerman treks, later on this year, it speaks to the power of cell and gene therapies. So let me start with who I am. My name is Rita Johnson-Greene, and I am the Chief Operating Officer at the Alliance for Regenerative Medicine. And as COO, I'm responsible for our 2 revenue streams, so membership and events, as well as people and culture, finance, and our Asia Pac initiatives that we'll be talking about later on. And I'm also responsible for the wonderful weather that we had last night that enabled us to have such a great such a great reception. So obviously that's not true, but I do appreciate the applause. But it was a great reception last night, and just appreciate everyone who came out and celebrated the wonderful weather and the transition from the rain that we had on Monday. But I am excited today to be talking to you about the progress that we've made globally at ARM, and then some of our new initiatives that we're launching. But before that, I want to just tell you a bit about ARM. And I know that Bob Smith, our chairman of the board, went through this slide yesterday, and so I am not going to walk through the entire slide, but I do have two key things that I want to share. The first one is convening the sector. ARM has two large conferences each year. One is Meeting on the Mediterranean, which is where we are right now, in case you weren't sure. And the other is Meeting on the Mesa, which takes place in Phoenix, Arizona in October. And what we call our secret sauce is the networking and the high executive level conversations that take place at our conferences. And that's really due to the high C-level attendance that we have at our conferences. And so this year's Meeting on the Mediterranean actually has 35.5% C-level attendees. And this is up from the 29.7% that we had last year. So just really proud of the network and the deals that are made at this conference, because it is our secret sauce and one of the things that ARM's really proud of. The other thing that I'd like to call to your attention is the QR code that's on the top right of your screen. And that, just as Bob said, if you're not a member of ARM, we'd like you to consider becoming a member of ARM. And just as Tim said yesterday, now is really a time to be networked and be a part of a community, and we really invite you to be a part of the ARM community. Now, last year at Meeting on the Med, we played a game, and this game was to pick the top 5 countries that are attending this year's Meeting on the Mediterranean. And so I want to start by telling you that it is not the same ranking as last year. So for those of you who got the answers right last year, try again. It's worth participating. But let's start. So what's the #1 represented country? Easy. Come on, call it out. I can't hear. US. Okay, US, yes. Okay, what's #2? Oh, come on. I feel like people aren't awake. UK, yes. Okay, here's where it gets tricky. What's #3? Close? I think I heard it, Germany. So Germany is #3. Hold on. There we go. Germany is #3, and actually Germany was #5 last year. Okay, #4? France, yes. And France was #4 last year. And then what's #5? Italy, yes, and Italy was #5 last year. So, okay, thank you all for playing. I hope that now we're all awake, and so I'll move into the presentation and talk a bit about some of the activities that we're doing in Europe. And so one of the key goals that we have this year for Europe is to continue to sharpen ARM's European engagement. And this is really by us making a very deliberate effort to host more ARM events in Europe. And so, some demonstrations of that, our science and industry team is actually hosting a workshop in Europe for the first time ever. And the title of that workshop is Advanced Manufacturing and Industrialization of the Cell and Gene Sector. And I want to thank Catapult for being a sponsor of this workshop, and it's taking place in Stevenage, UK. And then also, our public affairs team is having a Cell and Gene Meeting of the Minds that's taking place in September. And the focus is going to be on real-world evidence. And this is a continuation of the Meeting on the Minds meeting that took place in December of 2024. And there's going to be a publication that's coming out about that. So please stay tuned for that. We also had our ethics and cell and gene discussion with the Vatican's Pontifical Academy of Life, and Tim talked a bit about that yesterday, but again, just other events that are taking place here in Europe. And then, of course, we want to increase our EU headquartered membership. And then lastly, continuing ARM's EU public affairs efforts. And that's what I'm going to talk a bit about on this next slide. And so I know that Tim walked through this slide yesterday, but some of the key things that I want to make sure that I call out, and then really kind of focusing on outcomes, is that, first of all, we want to advance our fit for purpose joint clinical assessment, right? And ARM is really working to ensure that the joint clinical assessment and member states will accept evidence from single arm trials through real world evidence, right? And so one outcome that's associated with this is that it's been recognized from the European authorities that single arm trials would be accepted as evidence in the joint clinical assessment. And so that's due to the powerful work of Paolo Marghesi, who heads our European efforts, and then of course, the entire public affairs team. And next is, effective guardrails for hospital exemption. And again, one of the outcomes associated with that are that our key asks associated with those guardrails will be included in the draft European pharmaceutical legislation. And so again, just due to the tremendous work of ARM being a convening sector and all of the multi-stakeholders that we've brought in to advocate for this. And then, third is partnering with EMA in our modernization efforts. And I mean, you've seen the EMA influence throughout this entire meeting. And then lastly is addressing access barriers in Germany. And so again, just want to thank Public Affairs as well as Paulo for leading these efforts. And so next I want to talk a bit about our Asia Pac initiatives. And so last year we did a lot of work. We had a survey that we did on commercialization in Japan. We did a white paper, and we also launched for the first time our Asia Pac Forum, which is open to all members who are interested in learning more about Asia or lending your expertise about Asia. And when we talked to the forum members last year, because we hosted 2 forums, we asked, what are the key things that you want us to focus on as we progress into 2025 and 2026? And these are the 3 key focus areas, 1 being market analysis, 2 being regulatory education, and then the last being events. And so this is what you'll see us focusing on from an Asia Pac perspective over the next 2 years. And now I want to tell you about some of the Asia Pac initiatives that we have this year. And so I'm excited to let you know that we are going to be hosting a half-day webinar series on Asia Pac, a virtual conference, on September the 10th of this year. And so please use the QR code if this is something that you're interested in participating in. But we're really going to be focusing on cell and gene therapy development, regulation, commercialization throughout the Asia Pac region. And then from an upcoming forum perspective, we have 2 forums that are coming up related to Asia Pac, 1 in June and 1 in September, but we also had one on March the 26th that was led by Tony Lee from MetaPost, and he led that session as well. So, a lot going on from an Asia Pac perspective, and really looking forward to you all participating. And so next I want to just quickly spotlight our US initiatives. Again, Tim walked through this slide yesterday, but I want to make sure that I round out all of the geographical work that we're doing, and we can't leave out our core US objectives. And so 1 is strong and innovative regulatory framework. Our 2nd is patient access to cell and gene therapies. And then last is investment in biomedical research like NIH. And so I want to also spotlight some of the science and industry work that we're doing. And I want to start with something that occurred in 2024, but this is our scientific exchange. And our scientific exchange, again, led by the science and industry team, is really about advancing the gene editing platform for rare diseases. And the 2 QR codes there, 1 is just an overall description of the meeting itself, and then the other is a white paper that we produced after the meeting. But what I really want to draw your attention to is the approach section. I mean, look at the various stakeholders that we were able to bring together in order to talk about gene editing platforms for rare diseases. And again, it just speaks to the convening and the multi-stakeholder approach that ARM takes with everything that we do. And then lastly are the outcomes. We have 2 publications that will be coming out later on this quarter associated with the scientific exchange. And then next I want to talk about some of the EU and UK regulatory engagement that we have for 2025. And first is starting with, with our meeting on the Mediterranean here. We have, EMA representation. We have CAT representation. We have MHRA representation at this meeting. And then if progressing to the bilateral meeting, that's a closed meeting with ARM and EMA. And then, our catapult meeting, as well as just continuous engagement from a scientific platform perspective. And so again, just really speaking to, our ability to partner with both EU and UK regulators. And I do want to make sure that I'm shouting out. I want to look at my notes so that I don't leave anyone out. But with regard to our Asia Pac Forum, I want to thank Josephine and Laura for all of the hard work that they've done from an Asia Pac perspective. And then when you think about our US public affairs team, I want to thank Erica, as well as Stephen and Adam and Patrick for the work that they've done within the team. And then going to Science and Industry, it's Josephine, Natalie, and Monica. So just really, I mean, our team works tremendously hard to ensure that we are approaching all of our advocacy efforts from, a multi-stakeholder approach. And I think that we're doing a great job, and you're seeing the outcomes of that. And so I'd also like to spotlight the women. We have our Women's Executive Forum that basically brings together C-level women who are a part of ARM companies, and just ensures that we are networking with each other, that we are uplifting each other. And if you are interested in the Women's Executive Forum, please contact Robin Muthig. And I want to thank Laura and Robin, as well as Susan Nichols, who's a member of our board, for leading the Women's Executive Forum effort. And I want to thank the women who attended this morning's Women's Executive Forum breakfast that we just had, and then they also scurried in here to make sure that they were supporting me for the Day 2 opening announcements. And I want to thank Catalent and Landmark Bio for sponsoring the Women's Executive Forum breakfast this morning. And then later on tonight, we have our Women's Cocktail Hour from 7 to 8, and I want to thank Forge and Scale Ready for sponsoring that cocktail hour. And so with that, I would like to bring up Paul Stoffels, who is the CEO and chairman of the board of Galapagos, and Bob Smith, who is a venture partner at Orbimed, as well as the chairman of the board of directors for the Alliance for Regenerative Medicine. Thank you.